Hi, I'm April Reese. I am a doctor of nursing practice and certified nurse midwife here at the Veranda. I'm also currently working on my psychiatric mental health nurse practitioner certification, and I'm pleased to take care of our patients at the Veranda. When you're just looking at the incidence of depression, it affects 15 point something million people in the United States, adults. That's just adults. It also affects children and adolescents. The rates can be as high as 1 in 33 kids and 1 in 8 adolescents. It is one of the most costly illnesses as far as workforce issues are concerned. The good thing about it is it's treatable. The unfortunate thing is many people don't seek treatment, mainly because of stigma associated with mental health disorders and being depressed. Women are at higher risk for depression, but men also have it too, and I think just because of how men are socialized in our society, they often don't seek help when they're having those kind of symptoms. And typically these are symptoms that are lasting greater than a 2-week period. And we all have times in our lives when we might be a little down, or our mood may be a little low, maybe because of circumstances or those kind of things. But if we're saddened and we're having changes in our appetite, sleep disturbance, sleeping too much, not sleeping enough, feelings of hopelessness, worthlessness, if it's interrupting our daily activity, we're not able to get out of bed, I don't want to eat, or I'm eating too much, thoughts of harming ourselves, thoughts of harming others. And that's the biggest step, is telling someone that you're having those symptoms. And many people just don't want to do it. Either they're embarrassed or they don't want to be stigmatized as having a mental health disorder. The great thing about it is that it's so treatable. 80% of people will get alleviation of symptoms or improvement of symptoms with some kind of treatment. I certainly believe in therapy and medication when it's needed. I think that there are times when medication is needed. I think there are some times when therapy is just not enough. I think therapy is a great avenue because it really does focus on the root causes oftentimes, especially if it's situational, circumstantial, that kind of thing. As far as the medication, I think you really have to be personalized. There are so many medications out there. There are new ones, there are old ones, so I think taking a personalized approach and not a one-size-fits-all, let's just give you this and let's go with it. And encouraging frequent follow-up, starting very low on a medication dosing, and let's see you back in a couple of weeks and see what mood. And then we could start spacing out visits as we start getting improvement in our mood and the symptoms.